What's the difference between shockwave lithotripsy and ureteroscopy to treat my kidney stones? Hi, it's Dr. Ghani from the University of Michigan. I get this question all the time. Patients call shockwave lithotripsy often lithotripsy, but the lithotripsy just means breaking the stone. And in shockwave lithotripsy, you're using a machine and specialized sound waves to break the stone in your body. You may be slightly awake, mildly sedated. There is no need to put anything inside the pee hole or in the bladder or in the kidney, and relatively not that much pain. However, when the stones are broken in the kidney, some of the small fragments that pass might become painful. Very rarely, those fragments might lead you into the emergency room. Important thing to know about shockwave lithotripsy is that it uses an X-ray or an ultrasound scan to find the stone in your kidney. So you need to have a stone that's really well visualized for it to be effective. Otherwise, it's not effective. And that's one of the major things about shockwave. It may not work for some patients. So that shockwave lithotripsy, it's not invasive, relatively low pain. However, there are some technical factors that prevent it being effective in patients. So we guide you through that. To learn more about this, look at the music leaflet called Choosing Between Shockwave or Ureteroscopy. Okay, so what about ureteroscopy? It's crazy. Patients find it really hard to say that word. Ureteroscopy, the most common surgery we do in urology. We put a fine telescope through the pee hole, into your bladder. It travels in your ureter, which is a long tube here. If the stone is in your ureter, that's where we are, then that's where we do the surgery. But if the stone's in the kidney, we use a bendable, flexible scope that goes into the kidney. It's an endoscope, like a colonoscope or a gastroscope, but it's really, really small. And we find the stone, and once we see the stone, we use lasers. You can see here, lasers. Lasers is a big deal in urology. And we use these lasers to break the stone into small, small, small pieces. I do a dusting technique where I break the stones into very fine fragments, and then I leave those fragments in your body, just like the shockwave machine, and wait for those to pass. It is more invasive, so when you wake up, there's more discomfort. Sometimes we have to put a stent. If you want to learn more about that, watch the videos on stent from our music soul group. But it is very effective, more effective than shockwave. Why is it effective? Because we can see what we're doing and we break what we see. We're not relying on a machine or imaging to find the stone. But it is invasive. It is a bit more painful than shockwave, but it's most effective. So unlike shockwave, where you might find out it didn't work and then you need to have, surprise, surprise, ureteroscopy. With ureteroscopy, it's one procedure that is more effective, but with a high risk of complications. To learn more, read about the choosing treatment options leaflet from music in my Well Prep page, and also watch the videos on ureteroscopy from our team at music in the soul group. You can get shockwave or ureteroscopy, but sometimes if your stone is in the ureter, shockwave is not offered. It's not something that we do here in the United States. So in that scenario, ureteroscopy is the #1 treatment. If your stone's in the kidney and it's easily seen and there's just 1 or 2 stones, then shockwave becomes a very good option. One area you need to be mindful of is stones in the bottom of the kidney. That area with shockwave lithotripsy doesn't have the best results because it's harder for the stone pieces to come out at that part of the kidney. Thanks for watching this video.